Hey there, in this video, let's talk about meniscus tear. Hey there, welcome back to my channel. This is Elbu, your exercise physiologist, here to help you better understand your body so that you can improve in your fitness, your health, and your performance. Okay, so we will cover the anatomy. We'll show you where is the meniscus, the function of the meniscus, and then we'll go through what causes meniscus tear. So let's start off with where is the meniscus, right? So let's go back to our anatomy again, and here you see is basically our knee, right? Covered with muscles, and if I were to take the muscles away, and this is what you see. Okay, all the other tissues, and the meniscus is basically just sitting in between these two bones, right? So this whitish area that you see is basically the meniscus, and it's sitting between the femur bone and the tibia bone. Okay, so this is basically the location. So what is the role of the meniscus, right? So in textbook, in literature, this is what you will find, right? So it acts as a shock absorber. This is part of what it does, but it's not the main function of the meniscus. Okay, we'll cover that later on. Load transmission, it's supposed to spread the weight more evenly, and you realize that for a lot of meniscus tear, most times it doesn't happen this way, and there's a reason for this as well, and it has to do with the previous point, which is the shock absorber. All right, so anatomy again. The muscles around the knee is supposed to act as a shock absorber actually. Okay, if you take a look at it, comparing the size between your meniscus and the muscles, it's too little to absorb any shock. Okay, so if the muscles are not doing their job, then this guy has no choice but to take that shock. It's really like the last piece over here. Okay, if this is not here, as in the meniscus is not here, and if the muscles are not working, basically this bone is just going to be rubbing on this bone. Okay, and it's going to be pounding on it. So even before that happens, you realize that the reason why when we break fall, when we slip and fall, when we try to move away, usually we have a sudden move to move away from an accident, or to prevent any accident from happening. Your body absorbs a lot of shock, and you realize that actually the muscles are actually firing to absorb, to make sure that it takes on all the load. And if that's okay, then no problem. It's basically the muscle's job. It's supposed to help the body to move, and also it supports the body frame. All right, this is a very general, very big thing to talk about. But in short, whether it's concentric movement, whether it's eccentric movement, whether it's isometric movement, it's all involved, right? The muscles are actually there. So if the muscles are weak, doesn't do the job, or if there's any imbalance, then other parts of the body needs to be doing this job. All right, so it can happen to any parts of the body. It really depends on what you were doing, in which position, what position did it happen. It meant a lot. Okay, so then it is also there to increase the joint stability, which the muscles are also supposed to do most of it. The last thing the muscles can't do, okay, this is basically the joint lubrication. It's supposed to help the bone glide smoothly when you bend your knees. Okay, and so what causes degenerative meniscus tear, right? So again, in literature, in textbook, you will really usually find overweight. This basically, there's two ways to look at it. One is that because of overweight, the load is too much, the body can't handle, thus causing the meniscus tear. Now, the other way to look at it is that if your muscles are not strong enough, if your muscle strength is not kept up at that level, then of course you can't handle the load. So So there's different way to look at it. One is that the load is higher, one is that actually the strength is decreasing because it decreases over time, and I talk about it in my previous video. Okay, and the next point, it has to do with well, overweight as well, poor exercise fitness. So one thing, yes, overweight. The other thing is that you're losing strength because you're not doing enough exercise. Okay. And then yes, we basically covered this weakness in the muscles of the thigh and the bottom. The bottom basically refers to your calf muscles. Okay, so tightness. This also means that if you are training enough and you're not stretching enough, or it doesn't loosen up the muscle can't function properly. So tightness actually do cause muscle to not function properly, and thus having other parts of the body to take up the load. Okay, so this is one reason. And overactivity basically also has to do with tightness of the muscle. But the other thing to bring across is that if you're doing too much and the muscle doesn't have the chance to rest and recover, again, then other parts of the body have to be taking up the load, right? Or you're just doing too much and then you're just pounding on the meniscus, right? So a common meniscus tear will look something like that, and you realize that there's different parts of the meniscus being torn, and everybody that has got meniscus tear, until you get yourself an image scan done, any imaging, it could be X-ray, it could be MRI, you wouldn't know as what exactly it is. Okay, so to bring this to you, okay, so we saw the meniscus from the front of our body, right? So this is basically coming from the top view. Okay, so if we were to cut across the meniscus, this is what you see. So now this is the back of our body, this is the front. Okay, so basically you are just cutting through the knee and you're seeing the meniscus from the top. Okay, so like I mentioned, if the muscles are not functioning properly, it can also do with your lifestyle, your habits, the way you stand, the way you function. It could be internally rotating of the hip, it could be externally rotating of the hip, thus causing more load on this side or this side, right? It could be that the weakness of the muscles are not functioning well, right? Then it could be loading more on this area, right? So it really depends. Everyone's meniscus tear may be slightly different because it's very hard to track lifestyle and habit. And until things happen, we can then say, oh, it's because the way you have been doing certain things and all this. Most of the time, before you feel pain, your body would already be hinting you on different things, right? Most people choose the fastest way to get it sorted out because they think that's the only way to do. So for example, if you're feeling muscle soreness, tightness around this area, which I've gone through earlier on, your thigh muscles, your hamstring muscles, your calf muscles, they are actually hints to your body that you may be doing certain things inappropriately, and that's the body's way to tell you something's not right. Right, so most people would go for like massages, which is okay. It helps relieves the muscle soreness and aches and all this. But if this keeps repeating because of how you're using your body, then you've got to make sure that it doesn't happen so often, right? I do go for massages, but it's not an everyday thing. It's not even a weekly thing. I do it when I feel tired and I know that the muscles need it. And it could be once every 2 months, once every 3 months, right? So could sometimes be even more than that. So that's something that to think of, because you don't want to do the massage like you're taking painkiller. The concept is the same. Most people feel pain and they take painkiller to mask off the pain. I know how that feels, but in the long term, until the tear happens, you know that for the past maybe 5 years you have been doing things wrong, and it's not easy to reverse the effect because it's already been damaged. Okay, so that's what I want to cover with you in this video. I will also link an article so that you can read. Basically, it's all covered within this video, but if you are interested to read the article, you can do so. Okay, so basically that's what I have for you for degenerative meniscus tear. Most of the time it happens over time. It's very difficult for a lot of people to understand. It doesn't happen overnight, so it has to do a lot with your lifestyle, your habit. Muscle weakness contributes to it, muscle overloading also contributes to it. So remember what I mentioned. If you are feeling something that's not right with your body, it just means that your body is trying to signal you on certain things, and it's always good to seek professional help. Even good to just search online, because you are then more knowledgeable, so that you can actually help yourself with certain things. Okay, so that's all I have for you in this video. If you like this video, don't forget to click on the like. This way YouTube's algorithm will help people who are suffering from very similar issues like you, to show them this video. And then don't forget to subscribe and to hit the bell notification button, because once I post a new video, you will then be notified. Okay, so please take care, and I will see you around. Bye bye.